CNA Practice Test 2026 Certified Nursing Assistant Full Course Feeding Dressing Residents. Question 1. What is NPO? Nothing by mouth. New patient only. Nutrition per order. Nightly pulse observation. NPO stands for nil per OS or nothing by mouth. Question 2. How many milliliters, ml, are in 1 ounce, Oz? 10 ml, 30 ml, 50 ml, 100 ml. 1 ounce is approximately 30 ml. Question 3. What should a CNA do before serving a meal tray? Taste the food. Check the resident's ID and diet order. Add salt to the food. Cut everything into tiny pieces. Ensuring the right diet for the right resident is critical for safety. Question 4. What is aspiration? A type of breathing exercise. Inhaling food or fluid into the lungs. Feeling very hungry. A skin condition. Aspiration can lead to pneumonia and is a major risk for those with dysphagia. Question 5. How should a CNA help a resident with a visual impairment eat? Feed them everything. Use the clock method to describe food locations. Don't describe the food. Tell them to wait for a nurse. The clock method promotes independence for the visually impaired. Question 6. What is recorded as output? Food eaten, urine, emesis, and wound drainage. Water in the pitcher. For fluids only. Output is any fluid that leaves the body. Question 7. A clear liquid diet includes milk and orange juice, apple juice, broth, and gelatin, pureed meat, coffee with cream. Clear liquids are those you can see through at room temperature. Question 8. What is the best position for a resident to be in during feeding? Supine, high fallers, upright, lateral, prone. Upright positioning helps prevent choking and aspiration. Question 9. Which of the following is a sign of dehydration? Clear urine, dark, concentrated urine and dry mouth, high energy levels, frequent urination. Lack of fluids leads to concentrated urine and thirst. Question 10. What is a midstream or clean catch urine specimen? The first urine of the day. Urine collected after cleaning the area and starting the stream. Urine from a catheter bag. All urine for 24 hours. This method reduces contamination from the external skin. Question 11. What is dysphagia? Difficulty speaking, difficulty swallowing, difficulty walking, difficulty sleeping. Dysphagia requires special diets, like thickened liquids. Question 12. A resident has a fluid restriction. The CNA should give them as much water as they want, keep track of all intake and offer small amounts, stop giving them any fluids, ignore the order. Fluid restrictions are medical orders that must be strictly monitored. Question 13. What is a stool specimen? A sample of urine, a sample of feces, a blood test, a skin swab. Fecal samples are used to test for blood, parasites, or infection. Question 14. Force fluids means making a resident drink through a straw, encouraging the resident to drink more often, using and for pouring water into their mouth. It means encouraging increased fluid intake. Question 15. When measuring intake, the CNA should count only water, all fluids including ice cream and soup, only what is in the glass, nothing. Any food that is liquid at room temperature is counted as intake. Question 16. What is the purpose of a 24-hour urine collection? To see how much they pee. To test for specific chemicals over a full day. To save time. To avoid using the toilet. All urine must be collected for 24 hours to get an accurate profile. Question 17. What is incontinence? The ability to hold urine, inability to control bladder or bowels, constipation, frequent urination. Incontinence requires prompt skin care to prevent breakdown. Question 18. Perineal care is cleaned from back to front to back, side to side. It doesn't matter. Cleaning clean to dirty front to back prevents UTIs. Question 19. What is occult blood? Visible red blood, hidden blood in stool, a type of blood type, vampire blood. Occult blood is not visible to the eye and requires a chemical test. Question 20. What does a diabetic diet usually control? Protein, carbohydrates and sugars, fats, water. Managing glucose levels involves monitoring carb intake.